Hi, today we're going to talk about a clinical case about a 73-year-old man with confusion and recurring epistaxis. First, we're going to define what is epistaxis and mental confusion. Now we're going to watch about mental confusion. Now we're going to continue with the clinical case. A 73-year-old man with multiple chronic medical illnesses was admitted to this hospital because of confusion and irritability. 2 days before this admission, increasing weakness, lethargy, chills, and diarrhea developed. The patient became less responsive to his family and increasingly irritable and confused. He stopped taking his medications. One day, on the day of the admission, his oral intake was 500 ml of liquid. His family reported that he was in an almost catatonic state. He was unable to arise from bed and had recurrent epistaxis and reported pain in his chest and left arm. He was brought to the emergency department of this hospital. The patient had been in poor health with a recent diagnosis of atypical pneumonia, which was treated with levofloxacin. He had a history of diabetes, atrial fibrillation, coronary artery, diastolic heart failure, and pulmonary hypertension. 1 month before this admission, the patient had been admitted to this hospital because of acute confusion and worsening edema. During that admission, an ultrasonography of the right upper quadrant was performed. Here we can see the right upper quadrant ultrasonography. The patient has 3 out of 4 of the criteria for having hereditary hemorrhagic telangiectasia, which is later confirmed by gene testing indicating anomalies in the ENG and ACVRL1 genes. An image of the right lower lobe of the liver showed a communication between the right portal vein and the right hepatic vein, a finding consistent with hepatic venovenous malformation with portosystemic shunting. A diagnosis of hepatic encephalopathy was made. The confusion improved after the treatment began with lactulose and rifaximin.